Since 1994, hundreds of communities across the United States have joined together to celebrate the critical role vaccination plays in protecting our children, communities, and public health. The details of National Infant Immunization Week are coming up on Polk Place. Hello and welcome to this episode of Polk Place. I'm your host today, Dion Spires. In studio with me today, I've got two very special guests to talk about a very important event. I've got with me Monica Guy, the LPN for the Florida Department of Health in Polk County, and Jennifer Dickinson, the Senior Community Health Nursing Supervisor of the Florida Department of Health in Polk County. How are y'all doing today?
Wonderful. Doing all right.
Thank you guys for being here today.
Thank you for having us.
Super important event to talk about to really raise some awareness in our community. It's National Infant Immunization Week. Tell me a little bit about what the cause of that is and why it's so important to our community.
National Infant Immunization Week is an annual observance in which the importance of protecting infants and children from vaccine-related illnesses is emphasized. In 1994, when the NIIW was first observed, the nation was experiencing a serious measles outbreak, and communities across the United States were showing a very decreased rate in infant and children immunizations. Vaccination is one of the most cost-effective and successful public health tools in reducing illness and disease. Not only do vaccinations provide protection from the individual that received the vaccine, it also protects the community by reducing the spread of infectious diseases. We want parents and caregivers to be aware of the VFC, which is the Vaccines for Children program, which provides vaccines free of charge to school-age children up until their 19th birthday. These children who might not otherwise receive vaccines due to inability to pay.
And how do they take advantage of that program? Is it available to anyone, or is there a sort of qualification for that? Or?
Anybody of school-age children up until their 19th birthday qualifies for VFC.
And we just come into the health department as a walk-in. We have the schedules for all the clinics. If you want us to give that information here, we can. But they just walk in, say they're there for shots, and we can take care of their immunizations while they're there for free up until their 19th birthday. We do have some other programs for people who may not have insurances, who don't cover specific vaccines, or who may have no insurance at all, for people over 19 as well, and that's our 17 program. So there are some things they can benefit from by coming into the health department just to check it out and see even. But for the children, definitely it is free up until the 19th birthday.
Wow, that's great. I've never heard of that program before, and that's definitely a huge help to anyone who wants to get their children vaccinated, because cost is half the battle, I feel like, for a lot of people.
We want parents to be aware that no child should not receive their vaccines due to inability to pay.
Definitely.
Exactly. And they can come, to the Auburndale Health Department. We do it all week long, is Monday, Tuesday, and Thursday from 8 to 11. And then Wednesday at Auburndale Clinic is from 1 to 4, and Friday is 1 to 3:30. Then we also have our Lakeland Clinic. Lakeland Clinic does immunizations all day long from 8 to 11 and 1 to 4. Our Lake Wales Clinic does Monday, Wednesday, and Friday from 8 to 11 and 1 to 4. And then Haines City Clinic does Tuesdays and Thursdays from 8 to 11 and 1 to 4. They can also find those hours on our website. It is sometimes hard to get to those hours, but you can just type in hours for the clinics, and it'll list all the clinics and their hours and their locations and their phone numbers as well. So they can give us a call if they have any questions, but they can also just go online and check it out and see what's available for them.
Nice. So lots of opportunities for people to take advantage of that.
Exactly.
Now with National Infant Immunization Week, can you guys tell me a little bit about what you guys are doing to get the message out during that week? Are there events, or are there things that the community can come out to? What's going on that week?
We promoted in all the clinics, in all the areas, our WIC, our dental, even our maternity and our family planning clinics. We want the word out there about the importance of receiving vaccines for everyone.
And it's not one thing that we're doing particularly. It's just having that chance annually to say, hey, look, this is Infant Immunization Week, reminding parents that they want to make sure their children are up to date on their vaccines, bring them in, keep them up to date. But we do promote that every day throughout, like Jennifer said, with our family planning, our WIC clients, pretty much our whole clinics, all of it. We do promote vaccinating within that every day. But we do like to say, hey, annually, parents, check and see if your kids are up to date. If not, come to the health department. We can help you out with that and get you squared away. So that's just, we do post pictures and we have posters that we do post for National Immunizations, the Infants Immunization Week, that we do have posted in our clinics. But like I say, we do promote that every day.
Of course. Now, are there certain immunizations that you would say children should be, or parents should be most cautious about making sure their kids are up to date? What are like the really important things that the kids need to be protected against nowadays?
Nowadays, when they're 2 months, 4 months, and 6 months, they're going to get tetanus, hepatitis B, polio, Hib, and pneumonia, and rotavirus. And that's what they're going to get for 2, 4, and 6 months. When they hit a year old, they start getting into a couple of the newer vaccines, which is new for them. It's not new, it's been out a long time, is the measles, mumps, rubella, the chickenpox, and the hepatitis A. At that point, they're pretty much up to date. We also offer flu once they hit 6 months old, but that's the very minimum. And then after that, we try to make sure they're up to date by 2. With all of those immunizations, we try to give between 1 and 15 months old are the tetanus, the Hep B, the polio, the Hib, and the pneumonia, the measles, mumps, rubella, chickenpox, and hepatitis A. When they reach 4 years old, they get boosters for tetanus and polio again, and measles, mumps, rubella, and chickenpox again. The next time after that would be their Tdap, which is the tetanus, diphtheria, and whooping cough, which they get when they are 11 years old. It is required for 7th grade, but a lot of kids are not in 7th grade when they turn 11. A lot of them are still in 5th grade. So you still want to get your child in to get that Tdap at 11 years old, so that way they have it, their body is in need of a tetanus at that age. So you want to go ahead and take care of that at 11 years old. And then when they are adolescents, we do try to offer the HPV vaccine, which HPV itself is a virus that causes cancer. So this vaccine protects our children from these types of cancer. It is best to vaccinate your child for HPV prior to their first sexual encounter ever. Because the very first time a person has sex, they're mostly exposed to HPV the very first time. So we want our children protected against that virus before that ever happens in their life. So that way they're not catching these viruses that cause cancer, genital warts. And then also we really highly recommend as well the meningitis vaccine at that teenage year. We try to give it at 11 and then give it again at 16 because there has been some outbreaks of meningitis within colleges in other states, as well as was a case in Florida about probably 6 months to a year ago that had happened and someone died from that. So it is very, very important to have your meningitis vaccine, especially if you are thinking about college, but not just if you're going to college. You should get it just because you're in school. And being in school, you're around all those kids and can share drinks with their friends or kiss some boys and girls sometimes. and playing sports, a lot of them do share their drinks, and you don't want them to catch meningitis, and that's one way they can catch it is by sharing drinks with their friends. So the three, the Tdap, the HPV, and the meningitis are those 3 main ones that we do offer once they become 11 years old. The HPV can be given as young as 9 years old, but that's up to the parent if they want to start at that young. We just want their child to be protected before we ever get to that first sexual encounter.
Right, absolutely.
But
now I know that especially with infants and children, there's some parents that are kind of concerned about immunizations. They're not big fans of it. So being that you guys are trying to promote this, what do you have to say to kind of reassure them to come out and get these immunizations taken care of?
There's a lot of parents, do have concerns. There's been a lot of stuff online and things about certain topics regarding vaccine that makes them nervous. When they come out, we try to talk to them, and we give them the information sheet from the CDC. It lets them read about the vaccine in depth. So we give each parent this every visit, every time they get a shot. We give them this information. We tell them, hey, if you don't want to decide today, don't decide today. Take it home, read over, do your research. And then if you decide you want it, come back. And it's still free up until the 19th birthday. So, but we do try to emphasize that. And then I know everybody has their own beliefs of what they want for their child, but they just have to do what they think is best for their child. But it does show proof that immunizations do work, because the 30s, 40s, and 50s, we had a lot of measles, a lot of polio and things like that are no longer around due to vaccinating. Vaccinating brings, community immunity. So everybody is protected. And when people stop vaccinating their children, it can leave their child open to that exposure to spread it to others.
Absolutely.
So we really want to stay safe as a community. In Polk County, we have a 95% rate of everybody being immunized, and we don't have many outbreaks of anything. We are very high in our percentage. We have been for years. So it's very good to just, we have lots of information we can give the parents too if they're unsure. There's lots of questions and printouts we have from the CDC that we can give them to research on their own if they have questions. But we'll talk to them and teach them everything they want to know about this vaccine, why they're getting it, when they get it, how they get the disease, and then why we're giving the vaccine. Because a lot of the vaccine-preventable diseases, we don't have cures for those diseases, and they have treatments and things they can do, but your best protection is getting the vaccine. And that's the best protection to almost all of these diseases out there that they have made vaccines for.
Well, it's great that you guys offer all of that information, because education really is key. If you're not certain about something, it's the only way to go.
And one thing we do encourage is not to get all your information online.
Right.
Discuss your
the source.
concerns and your cares with your health care provider. We know that the internet is not always 100% factual. So any concerns or hesitancies that you may have, discuss it with your health care provider.
Absolutely. Now, we've talked a lot about immunizations. When is National Infant Immunization Week? We haven't said the date yet.
It is observed in the United States the last week of April.
Okay, great. And if someone wants to get more information on the Florida Department of Health in Polk County or National Infant Immunization Week and how they can get their kids vaccinated during that time, where can they go? Website, social media, phone number?
All of the above.
Our phone number, because we've had some phone number changes. So our main phone number, so I'm going to give that out now, is 863-519-7910. That is now our main phone number for the Florida Department of Health in Polk County. They can hit option 3, which will take them to the scheduling center where they can speak with someone, and they can direct them in the way they need to go. If they have a question, they just want to call one of the immunization nurses and ask a question, they can do that. They can also leave message for us. They can also go online, because not only do we provide, vaccinations, we also provide family planning, birth control, STD testing. We provide OB care. We also have adult health for people who qualify for our low-income pool. So and then we have dental and WIC also in the same facility. So it's not just immunizations, it's all one big group, the things that we have, so they can go online and check that out as well.
Great. Well, thank you guys so much for being here to talk about your services and this week of awareness.
Thank you very much.
Thank you for having us.
The Florida Department of Health in Polk County invites you to join them in participating in National Infant Immunization Week, April 22nd through May 3rd. National Infant Immunization Week is an annual observance to promote the benefits of immunizations and to improve the health of children 2 years old or younger. Through immunization, we can now protect infants and children from 14 vaccine-preventable diseases before age 2. For more information, you can contact the Florida Department of Health in Polk County at 863-519-7910. then press 3 for medical services, or look them up on the web at mypolkhealth.org.